Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. But before we get started, let's reach into the top hat for the magic illusion of the week. This is one of my very favorite tricks to do in the dental office because it uses an ordinary piece of rubber dam and 2 coins. Have your patient select either one of the coins. They will usually pick the quarter, and press down gently and watch what happens to the one they've selected. It penetrates the rubber dam and goes down into the glass. They can examine this all they like because there is no hole. To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. Well, the theme of today's Root Tip of the Week is dentistry. Now, I love that trick where the coin goes right through the rubber dam, don't you? It's one of my favorites, and every dentist should be doing it. Today's Root Tip of the Week, we're going to talk about a show that I think everybody ought to tune into and keep an eye on because it's very interesting, a lot of good information, and it's the Dr. Oz Show. Now today, Dr. Oz is going to feature dentistry, and I'm not going to tell you any more about it because I don't want to take any time away. A lot of good information here. Enjoy this Root Tip of the Week.
Get comfortable, it's a very important show today. The doctor most of you refuse to see because of fear, panic, terror, and dread is the most dangerous one to skip. This appointment can prevent the most deadly diseases. Now, as a surgeon, this is especially troubling for me because too many people end up on my operating room table simply because they avoided the dentist. Here's why you should never skip this visit.
You could be missing a visit with one of the most important doctors you could see. Indicators of heart and lung disease, cancer, stroke, even diabetes. 80% of all American adults have some form of gum disease. Nearly 1 in 4 have untreated tooth decay. Your teeth and gums say much more about your body than you ever imagined.
Well, the dentist really is the first line of defense. We almost act as dental detectives. And this is not really to judge our patients. We want to educate them and we want to get in there early. So the dentist and the hygienist, what we see can save your life.
There's now regular dental checkups. They prevent 3 of the diseases that you fear the most. And the first disease that we fear is heart disease.
It's really about plaque. You know, you wake up in the morning, you run your tongue on your teeth. It's that thick, viscous substance. Well, bacteria gets into that during the night. It colonizes the roots and the gums can get inflamed. You could get decay from it. So it's very important that we really manage how much plaque we have in the mouth. More plaque, more heart disease.
This is how we think about the stages of plaque in your mouth. So you just brushed your teeth. It's the morning, everything's going fine. 2 minutes after brushing, it looks pretty good here. No real issues going on. But the food you eat during the day, by 24 hours later, has begun to stain the teeth, begun to deposit there. And then, as you let that teeth bathe in the fruit and the material that you've eaten, 4 to 7 days later, it gets a little bit harder, the stain gets deeper. Now you're creating an entire environment that within a week to 3 weeks later, 7 to 21 days later, gives this hardened plaque as minerals and other chemicals that the bacteria are churning out begin to destroy the enamel of the teeth and change it for good. You know, the impact of the teeth, it doesn't just stop with your heart and the arteries to the heart. It also extends to the brain. I want to be clear on this. What I'm trying to say is that dementia is not just something that happens because of your genes. It's because of the inflammation in our body. And the more we study diseases like Alzheimer's, the more we realize it's about inflammation. Make sense? All right. So you see the gums begin to recede and they get angry and red because there are bacteria under it. And these bacteria are creating this entire network and framework where they're battling you, creating gingivitis, redness, that rawness, that angry looking gum releases bacteria. Those little, and as they go through your bloodstream, they eventually go to your brain. And those bacteria set up shop inside the artery, and they will attach platelets, which are the round, sort of greenish structures, and those blue rods of bacteria will begin to form clot as they inflame the artery. And then they lead not only to strokes, but the irritation that we know results over time with diseases of dementia, of senility. Now, this is an important topic. We've talked about heart disease, we've talked about dementia, but there's one other area where we actually are now identifying for the first time ever a connection, and that's between problems occurring in your teeth and cancers in the body. Do you see that there? Right, that little whitish plaque, it looks very innocuous. That's an early oral cancer. At that stage, you can actually make a big difference in someone's survival and not have to do disfiguring surgery. Jonathan, how often do you find something like that?
We find it often, and probably too often, but there's some great technologies today that really allows us to get to it extremely early, just when the tissue is changing and becoming dysplastic. And what this is a blue fluorescent light. And normal tissue fluoresces, and in fact it fluoresces like an apple green color. But if there's any dysplastic tissue, and this is when you want to get the cells just starting to change, it will show up as very black. So stick your tongue out. We look at the side of the tongue, which is very important. Stick your tongue up. Floor of the mouth, open real big. We see the pharyngeal palatal area, soft palate, cheek. And we're looking all the way around and really highlighting everything to make sure that there's no dark areas, that everything has that healthy apple green look.
Alrighty, today I'm going to give you a quiz that a child should be able to answer. 4 simple questions about caring for your teeth. But, got to admit, I failed it. In the morning, when is the best time to brush your teeth? Simple question. Is it immediately after you wake up, immediately after breakfast, or 30 minutes after breakfast?
I say A.
She says A, immediately after you wake up. You are correct.
The reason is, you know, you wake up in the morning, you run your tongue on your teeth, you have that grunge mouth, right, and the plaque and bacteria are accruing on the teeth. You really want to get the brushing and the flossing, brushing for 2 minutes, flossing really effectively throughout your mouth right after. If you wait and you do it right after you have breakfast, there's a lot of acid in food, and you end up actually, because of that acidity, you could actually erode some of the enamel off the teeth. That causes a lot of sensitivities to hot and cold.
If you have only time for one, which of the following is more important? Mouthwash or flossing? They're not helping you.
Can I phone a friend?
No phone friend.
No lifelines, no phone
No
calls.
lifelines? Really? We can't call. I say flossing.
Jonathan, is she
Final
right?
answer.
You are right.
Yes.
You know, mouthwash is great for the person who doesn't floss and brush that effectively. It helps dislodge some of the food that might be between the teeth. But flossing, and nothing replaces flossing. In fact, it's the critical areas between the teeth is where we see the inflammation, and that's where we really have to get in there and do it.
How much toothpaste should you put on your brush? You do this every day, don't you?
Every day?
Is this a size of a pea? Is it the size of a quarter? Or is it C, enough to cover the bristles?
Well, if you watch commercials, it's C.
C, enough to cover the bristles. Well, what do you think it is?
C.
Yeah. The answer is A, the size of a pea.
Oh, wow.
The size of a pea. Jonathan, explain.
It is hard to believe that because it's intuitive. You'd think the more toothpaste you put on, the better. But you know, toothpaste has a lot of abrasives in there, and it actually also can cause a lot of wear, and you can get some sensitivity from it. Also, that toothpaste has fluoride in it, and too much fluoride actually is a bad thing. It's good for preventing decay, but too much of it will cause white spots on the teeth and cause fluorosis.
Okay.
Yes.
All right.
So let me show you what a pea size is going to be on the toothbrush.
Okay.
Okay, and it's really just that.
It's tiny.
Yeah. Now, the toothpaste manufacturers might not like this, but this is the truth. This is all you need.
All right, go ahead, take it home with you. It's the least we can give you. How long should your toothbrush last? Is it A, 1 month, B, 3 months, C, 9 months? What do you think?
I say 3 months.
So you think it's B, 3 months? And you are correct.
It's definitely not longer than 3 months. And if you had a cold and you were sick, you should change it right away. It's very important to know. So it might be even at 1 month. But 3 months is about right. And that's when you start seeing a little splaying of these bristles, okay? And it's really time to change it.
I will see you at our next Endo Root Camp.